Community Conversations for Health Research Mini Report. Number 1. What? We've been commissioned by the National Institute of Health Research, NIHR, to conduct some research aimed at removing barriers that prevent underserved groups from participating in health research. Number 2. Why? The purpose of the research is to understand the experiences and needs of these groups and individuals connecting to health research, to remove barriers preventing these groups from engaging in research, to work together to develop a plan for future research that addresses the needs of these groups. 3. How? We engage the following groups in focused discussion: visually impaired community, 7 people; Chinese community, 8 people; Bangladeshi community, 7 people, and interviewed 5 individuals who received care and support at home. 4. Findings. 4.1. Why do communities get involved with health research? A sense of genuinely making a positive impact for others, Chinese and Bangladeshi groups, and giving back to the community, visually impaired groups. Research should be relevant to their circumstances, condition, or interest. Care at home, visually impaired, and Chinese group. 4.2. What are the main barriers? The majority of participants have not taken part in any health research due to unawareness, lack of invitation, not meeting criteria, or encountering accessibility problems. All 4 groups. The Chinese and Bangladeshi groups face additional barriers due to language and culture. 4.3. Suggestions from the groups about how to remove barriers to research. The majority of people prefer trusted parties like the NHS, GPs, nurses, Health Watch, or community groups to contact them about research opportunities. All 4 groups. They prefer face-to-face meetings and community-based research. All 4 groups. Ensure all research sessions are accessible and provide appropriate support to meet different needs. All 4 groups. Provide one-to-one support. Care at home group. Ensure all materials and sessions are accessible. Visually impaired group. Provide interpreters. Bangladeshi and Chinese groups. 4.4. How to involve individual and communities. Recommendations. Improve access to research opportunities. Reach out to different communities via GPs and community groups such as Health Watch leads. Explain the research benefits clearly to individuals and communities. Offer flexible participation options to suit different needs, for example, face-to-face sessions as well as virtual sessions. Give thanks, for example, gift vouchers. Follow up with feedbacks about their participation. 5. Next steps. 5.1. Co-design accessibility training for researchers. Return to the community working groups and hear what people think should be included in accessibility training for health researchers. What should researchers be made aware of? How should researchers address different accessibility needs? How should researchers support participants? 5.2. Change how we recognize your involvement. How would you like to be paid for your time? 5.3. Bring our projects into community spaces, starting with Ask the Researcher. Ask the Researcher is a classroom-style event where one of our researchers talks about their research projects, answers questions, and engages in discussion with patients and public members. Similar projects include BioResource, a roaming educational van linked to another research project with AMR and infection.